Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Before we get started, I want to point out that down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. It has all the references that I mentioned in the video. It is the text for the video. Has all the backup material, links to news stories and medical journals that are related to the stories, as well as lots of references that you might be able to use. Some on reproductive and abortion care, some on what to do with claims denials. We have references so you can contact organizations related to other organizations related to healthcare reform. Let's get started. First, I have an example. I want to thank my wife for this one. This has to do with proving that activism works. Now, today, I believe, is January 27th of 2025, and last week was Donald Trump's first week in his second administration. He canceled hundreds of thousands of Veterans Authority healthcare employment requisitions. People who were ready to start their jobs were told to just go home, you don't have a job. 300,000 of them were canceled. The public outcry was so great over a single day that they reinstated all of those open requisitions to hire people with a special waiver to his executive order. There's a link to the Federal News Network story on that. But this is proof that activism works. So raise your voice and you get results. Let me talk about claims denials. We've talked about this one over and over and over again. Healthcare.gov insurers, so that's the ACA marketplace in states that don't have their own marketplace set up. This is the federal marketplace. They denied, get ready for this, about 20%, it's actually 19%, about 1 out of every 5 claims submitted for in-network service, and an even larger share, 37%, were rejected for out-of-network services in 2023. Kaiser Family Foundation analyzed the results, and there's a link to their analysis. The analysis examined the main sources of publicly available data on claims denials and appeals for individual marketplace plans available through the federal healthcare.gov marketplace, as I said. The Affordable Care Act requires certain entities to report data about claims and denials and appeals to encourage transparency about how insurance coverage works for enrollees. The publicly available data does not include marketplace plans sold on the state-based marketplaces, or, this is the biggest one, employer health plans, because almost half of us get our insurance, who have insurance, get it through the workplace. That is the nation's primary source of health coverage. Now, the analysis finds that there is huge variation across healthcare.gov insurers. And it's important that you look at this stuff if you buy your plan there, because they had some insurers had in-network denial rates as low as 1%. Some were as high as 54% in 2023 in some states. Nationwide, high volume insurers with higher in-network denial rates across healthcare.gov states included, get this, Blue Cross Blue Shield of America, 35% denials for 12 plans in a single state. United Health Group had 33% denials across 274 different insurance plans in 20 states. Healthcare Services Corporation had 29% denials across 915 different plans in 4 states. And Molina Healthcare denied almost a quarter, 26% denial rate for in-network claims in 72 plans in 9 states. And Elevance had a 23% denial rate across 154 plans. Of the limited information available on in-network claims denial reasons, get this, the most common reason for the denial, they checked the box that said other, 34%. That is, they give you no information. 16% said it was an excluded service. 9% involved lack of prior authorization or referral, hard to believe, and 6% said it wasn't a medical necessity. Other common reasons for denials included administrative issues, 18%, and exceeding benefit limits, 12%. Consumers appealed, get this, only 1% of the denials because they generally don't know to appeal them. And following those appeals, insurers upheld their initial denials 56% of the time, and consumers rarely took the next step to file an external appeal. You can generally always appeal to your state insurance commissioner, and they will get someone outside of the insurance company to review it. Anyway, you can actually find that, I think, in the resources section of the newsletter. Anyway, it's worth noting there has been a change. I've been writing these things for so long. It used to be that if you filed an appeal, about 80% of the time they would just approve it because they knew so few people filed appeals. Now it's down to 56%. Anything they can do to hold on to the money. Look, this requires action on our part. Let's ask our congressperson and senators to build legislation that publishes the insurance company denial rates for all health insurance plans sold in the U.S. so we can all be better consumers. As employees, as employers, if we have Medicaid, it doesn't matter. Let's get it done right. Because, you know, if the insurance companies, even in Medicaid, are denying people right and left, the state legislatures need to know that to get the right plan for people, not the wrong plan. Okay, it's not right to allow people to be forced into a health insurance plan with a 50% denial rate. Can you imagine that? Anyway, I have a link in the newsletter so you can call or email them, or my favorite way, on your cell phone or on a messaging app like Facebook Messenger or Telegram or something. Send a text message to 50409 to ResistBot. Here's the message. Sign SIGN space PVLCHD. Sign space PVLCHD to 50409. Here's the message you're going to send. I'm your constituent, and I just learned that health insurance companies are denying to pay claims or approve prior authorizations at outstanding rates. A Kaiser Family Foundation analysis of ACA plans from healthcare.gov found that some companies' denial rates are over 50%. This does not include plans sold on the state marketplaces. Specifically, they found that Blue Cross Blue Shield of Alabama, that was the way I should have mentioned Alabama before. Blue Cross Blue Shield of Alabama had a 35% denial rate for 12 plans in that state. United Health Group, 33% denial across 274 plans in 20 states. Healthcare Services Corporation, 29% denial across 915 plans in 4 states. Molina Healthcare, 26% denial across 72 plans in 9 states. And Elevance denied 23% of in-network claims on 154 plans in 7 states. Look, we all want to be informed consumers, but we can't be in this case because so much of the data is hidden from view. I want you to create legislation that publishes the prior authorization and claims denial rates yearly for every health insurance company that includes Medicaid and employer-sponsored plans and the state marketplaces, all of them. I need you to protect us. You know that if cancer treatment is denied, death is the result. Help your constituents. P.S. Here is the link to the Kaiser Family Foundation analysis. Hopefully their legislative analyst will look at it. I want to tell you that there is going to be a conference or a webinar on the Affordable Care Act and where it might be going. So if that's in your wheelhouse to understand that stuff, it's going to be at noon Eastern time on Monday, February 10th. Kaiser Family Foundation's Larry Levitt is going to be moderating a discussion with a panel of experts on the Affordable Care Act. In the newsletter, there is a link to RSVP, and I'll tell you what, I'll put it in the YouTube description box as well. You can just click on it and tell them you're coming. Well, let me tell you about Trump anti-health news from week 1. Ready? Number 1, Mexico City anti-abortion policy is back. President Trump on Friday, the end of the first week in office, reinstated a long-standing Republican anti-abortion policy called the Mexico City Rule, which bars federal funding from going to any overseas non-governmental organization that performs or promotes abortion. The move came after he addressed thousands of abortion opponents in Washington on Friday to mark the 52nd anniversary of the Supreme Court's 73 decision in Roe v. Wade, creating the national right for abortion, which the court overturned in 2022. Here's another one he did. Environmental protection for the poor. Trump says, drop dead. For 4 years, the Environmental Protection Agency has made environmental justice one of its biggest priorities, working to improve health conditions in heavily polluted communities, often made up largely of Black, Latino, and generally low-income Americans. Now that the short-lived era is over, President Donald Trump, in his first week, eliminated a team of White House advisors whose job it was to ensure the entire federal government helped communities located near heavy industries, ports, and roadways. Trump and menthol cigarettes. What does he have to say? Smoke them if you got them. The Trump administration has withdrawn the proposed rule that would ban menthol in cigarettes and flavored cigars, according to the regulatory docket. A menthol ban is something that the US FDA, under the Biden administration, said was a top priority. This is because it's more dangerous, okay? All right, anti-immigration policy hits the hospitals. Providers and industry watchers are concerned by a new directive from the Department of Homeland Security that allows law enforcement personnel to go into hospitals when looking for people without legal immigration status. On Monday, Acting Department of Homeland Security Secretary Benjamin Hoffman issued a directive that gives law enforcement permission to pursue people without legal status in or near sensitive areas such as hospitals and medical clinics. The tactic has been prohibited under the Biden administration. This guy is doing damage right and left. One of the things that I've been asked to write about, and I will hopefully later this week, is what's the effect of his administration on the National Institute of Health? It is in work. Down below, you can like, share, and subscribe. You can also send me comments here or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.